A dentist's world isn't just about teeth. It's about creating smiles and boosting confidence. Welcome to the first ever podcast of Mount Litera School, Nagpur. I'm your host Priyanshi, and in this episode we've got Dr. Amit Sharma, who is expert in all things smile related. He is also the reason why people get smiles as perfect as in the Colgate ads. So, welcome, sir.
It was a very nice introduction. Thank you very much for your gracious words. I am very happy to have talk with all of you guys.
It's our pleasure. Thank you for coming.
Yeah, sure.
So we have the questions here. Should we start with the questions?
Yeah, sure.
Okay. So the first question is, how is the dentist profession different from others?
Okay.
Can you tell us about it?
Yeah, sure. You see, when it comes to medical profession, not just being a dentist, I'm saying that. When it comes to profession that we are in, it's more about serving people than earning money. While earning is definitely a part of our job, like everybody else, but when it comes to our profession, it's more about how we can serve the people. Now, me being a dentist, we are specifically dealing with people who are having a lot of pain. So it's even one step further. So like we are able to help a patient, which is something which we feel only we can do that. A patient coming to us in a very severe shock or pain-like condition, and then getting relieved and going home happily gives a lot of satisfaction.
That's the happiness.
Yeah, so we are actually in the profession of creating smile and happiness.
That's a very good answer. So, what inspired you to become a dentist, and what keeps you passionate about this field?
Alright. So, to be very frank, my first idea of being a professional was not coming into the field of medical being. Actually, basically, I wanted to be a teacher actually.
Teacher?
Yeah. This is something which has been very close to me, and this is something which I always liked doing very much. But then I was good in studies. I was quite good in studies, and then among all the brothers and sisters that are there in my family, I was one of the best. And after I got good grades and everything, I was inspired by my parents to go ahead and try something new and go in a field where nobody else might have gone or bothered to even try. So at that time, when I was of the age like 18 or 20, going to a field which is, I'm coming from a very small and a simple background. So I am from Gondia, which is a nearby place. If you understand the psychology of the people where I come from, coming in a field of medical fraternity, being a dentist or a medical profession, it was a great deal. It was not just about being a professional, it was bringing pride to your whole family.
Inspiration.
Yeah, it was bringing pride to your family. So then I tried, let's see if I can do it. And then with wholeheartedness, I started preparing for my medical entrance, got selected, and then I chose this particular field. And the reason I chose dentistry is that this, according to me, gives you some extra space for your own self, for your family. You can have some of your own personal time also, which, if considering the other medical professions, like any other field other than dentistry, people can't have their own time. If you get a call at right 2 o'clock at night, you are supposed to reach your hospital at that particular time. Or there is no particular thing like you are having a holiday or something like that. We are not on holidays. We are on 24/7 working throughout the week, whole year and everything. But when it comes to dentistry, you have some space.
You have your personal space.
Yeah, you have your personal space. You can explore other things which you are into, and then it gives a lot of extra time for your own self. Like me being a dentist, other than that, as I already said, I liked teaching. When I was in 10th standard, I was teaching the kids from 9th. When I was in 12th, I was teaching the kids of 10th.
Wow, that's great.
Likewise, when I was in medical, college I was teaching my juniors. So that was something very close to me. And I came into the field, I started practicing and everything. But that deep down in my heart, that thing was still in an ignited state that I want to be somebody who can also go and meet kids every day. This brings a lot of extra enthusiasm and energy. Being with some kids every day, it brings you some extra energy, which I think is unparalleled.
Very.
Yeah, so same way I started teaching also when I was contacted by some institutions. So this is something I'm doing in parallel. I have my clinic time, which doesn't get disturbed by the time when I'm teaching, and the teaching time is completely in separation with my professional time.
So you're following your passion with your career.
Yeah, so this is the thing that I want to particularly highlight upon, that not just me, there are a lot of people who actually are trying to dwell in a different water which they did not want, but then you should not let your passion die. Even when you achieve something or you do something, in parallel you should keep on trying to do something which you really like. So it can be managed if we are careful enough. So like I said, I am managing the two completely parallel professions in a good, comfortable way. I am having no problems with that. So that was my inspiration of choosing this particular profession, and I'm very happy about it.
That's very inspiring. So the next question is, how important is oral hygiene beyond just brushing and flossing? And what mistakes do people often make?
Okay, so I tell you that this is a very good question, because most of the time people think that when they have brushed one time in the morning, then that is enough for having good number of teeth, and good teeth they will have, and they will have a nice beautiful smile. You see, a lot of it depends on the genetics of the person, the genes. If you have read about it, I think you might have had. So if somebody is having good genetic background, then they are fortunate enough to not get into a lot of trouble when it comes to teeth. But otherwise, in case of other than that, most of the 80-90% of the cases, people think that brushing once in the morning is enough, which is absolutely an incorrect idea. More than brushing, it's about the oral mucosa, the whole of the internal environment inside your mouth. Patient or people, when they think that they have brushed their teeth and they have done their hygiene thing, no. You see, 70% of the problems of the mouth, they do not actually originate from the teeth, but they start from the gums, tongue, and the mucosa around the teeth. You see, scraping of your tongue, cleaning of your tongue, is far more important than actually brushing the teeth.
Oh.
Did you know that?
No, I didn't.
So this whole thing, people think that they have brushed their teeth, they are in hurry. Kids are in hurry in the morning time, so they just do this 1 minute activity, and then horizontal brushing is one thing, where people brush like this. So that is not the right way. So in our country, this is something people are not very careful about, and most of the time people think this they have done is enough. So two things people should be very careful: the scraping of tongue and cleaning of tongue. It is a very traditional old way. People in olden time used to brush their teeth with neem twigs, and still that they kept on chewing it.
So that is datul, right?
That is datul, that's neem twig. They kept on chewing on it, then they dissolved the liquid of it in their mouth, and then they spat it out. It was like complete hygiene. After that, they used to scrap their tongue with the same neem twig. So that was a complete hygiene procedure. Nowadays, in the name of modernity, we are using the toothpaste in a very large proportion. 1 minute of vigorous brushing and thinking that we are doing better. No, actually we are going on the wrong path. You need very small amount of toothpaste. Proper brushing should take only 1 or 2 minutes, but the movement of your hand should be in accordance with the whole of the tooth circumference. Every part of your tooth should get clean. For that, you need to move your wrist more than you need to use your this pressure and arm and everything. So that is one thing that people are mostly not careful about. And after that, the scraping of tongue. I cannot give you enough weightage on this particular thing, because most of the time those people having good sparkling teeth have a bad breath in their mouth. And the thing about and the thing about bad breath is none of the person who actually have this thing in their mouth, like they're having the bad breath, they will never know. It is only the person who will come in front of them and talk to them. That person will understand that this person is having some issue. Yeah. Yes. So that is the thing about bad breath. So scraping of tongue is a very, very important part of the oral hygiene. And about brushing, it should be twice a day, 2 minutes, but in a proper manner.
Oh. Well, I'm taking notes.
Sure.
Okay. Now, with advancements in the dental technology, what are some of the most latest treatments or trends that inspire you or excite you the most?
Okay. So one thing is about the implant. In the age that we are in right now, there are far more advancement as much as I can see, and these things are like now recently innovated and developed. We people are also getting used to it nowadays.
Yes.
So there is one thing that is called as implant. Implant is a method in which we can replace a tooth which has been lost for whatever reason, by accidental reason, or the patient has got it extracted. Extracted means get it out. So in case of implant, what we do is we put a very small screw-like thing inside the bone of the person who needs to replace the tooth. And then after 1 or 2 months, when that implant gets hardened inside the socket of the bone, then we put a tooth over it. It looks exactly the same as it was before, like when the person lost the tooth before that, and we can do it even better than how the person was before. And the people, those people who have completely lost their whole set of teeth also, they can now even get teeth which are completely fixed in their bone. They don't need to remove the denture or anything like previously people used to put the denture and they pull it out. Sometimes it will get loose, and while talking to somebody it will move. So people get embarrassed about it. So nowadays we are having technology with which we can give permanent fixed teeth to those people who have lost it by accidental or natural reason. And that set of teeth is even better, not just in function but aesthetics also. Like I already said that aesthetics and smile is a big part of our profession.
Very.
So we can replace this whole set of teeth. That is one thing that is called as implant. Newer way in which we are now trying to modernize the treatment. And then we are having 2 more things which are now recently being developed also, and likewise they are also being adapted by us. One is laser surgeries. In laser, what we do, there is a very minimal amount of scar or cut that we have to make in the patient's mouth, and it creates no impression of that previous surgery has been done or anything. There is minimal bleeding, not much of bleeding or blood loss is there, so patient is very comfortable, and it is not painful also. So there is hardly any discomfort to patient. So that is another big thing. And these are the 2 areas in which I would like to tell people that there are a lot of ways now that we can do it even better than how we have been doing it till now. So that is that.
Technology has changed a lot.
Yeah, that is now being upgraded and being in sync with AI and everything. Now we are able to. You might have watched some advertisement in newspaper or television in which there is advertisement about bright white sparkling teeth. Not that of the Colgate. Yeah, not that of the Colgate. It is called as aligners or Invisalign, in which we can actually give the patient a data of the photographs and the videographic representation of how her or his teeth will look like.
That's very new.
Yeah, that is a very new way in which those proclined teeth, like in the age of like 12 to between 18, you are in school, you might have had friends who are having their teeth in an improper position. Some of them are in front, proclined or like that. So in Invisalign treatment, we can give appliance to wear to that patient, which is completely transparent and is like invisible. Nobody can see that particular appliance. And we keep on changing that every 12 days or 14 days. The patient needs to wear that for 6 or 8 months, and after that, the whole of the smile thing gets corrected. without doing any drilling, without any medication, without anything. And the best part, that the patient is completely in sync with the whole process. They can see that on the video or the demonstration that you already did. So that is another way.
That's great. Now, many people fear visiting the dentist. What advice do you have for overcoming dental anxiety?
Okay. देखिए, I would say कि about anxiety, it's a personal thing. A lot of people I see in my clinic who are aged and they are very fearful. And then similarly, we get a few kids who are at 8 or 9 or 10 years of age and they are absolutely fearless. They come. Yesterday only I had a girl. Her mother bought her because one of her front tooth was loose and it was supposed to get extracted. The girl who previously also had got treatment done at my clinic, she told her mother that please take me to the same dentist, because last sitting after completion of the procedure I had advised her parents that please give the good girl some ice creams and everything. So in that whole idea that was there in her head, so वो एक लालच था. She was like कि I will get the ice cream and my tooth which is loose will get removed without pain. So she came. So it's more about a personal thing, and mostly the dental fear is about a lot of misconceptions people have that if you go to a dentist they are going to pull your teeth out, you will be a lot of pain, there will be a lot of drilling. The thing about the dental clinic is that the drilling sound of the machine that we operate with, it actually is a little fearful, I would say. It is definitely like that. Yes. But it's more about when somebody has told you that this is something you need to be fearful about, then you would be definitely fearful about that. If you have never heard that a dental profession or a dental treatment is very, very painful, then you might be okay with that small amount of pain. It's not like a very big deal. Kids play football, cricket, they sometimes get hit, sometimes get bruised, or they get hit for hand, get fractured or something. It's like it's not like they're not getting injured anywhere else. When a professional takes 100% of the precautions which are supposed to be taken so that the treatment is completely painless. But it's more about a psychological idea that people already have. Now, how to get rid of that? I would like to stress upon a fact that it's more a way in which the upbringing of the kids should be done. It is a lot in the hand of the parents. The parents should be very careful about never saying to kids that कि अगर तुमने बदमाशी की तो मैं तुम्हें डेंटिस्ट के यहाँ ले जाऊंगा या ले जाऊंगी, या तुम्हारा दांत तुम ब्रश नहीं करते हो मैं लेकर जाऊंगा या जाऊंगी और तुम्हारा दांत हम निकाल देंगे, या तुमको अभी डॉक्टर के यहाँ ले जाते हैं सुई लगवाएंगे. These kind of threats that the parents are usually they are having very easy time when they say something like that. The kid gets all scared and everything and they start behaving in a proper way. So this behavioral modifications that happen in home, it creates a lot of problem when it comes to our profession, because when we get a patient like that who has already been behaviorally modified in
same as the police cops.
Yeah. So it is like good cop and bad cop wala thing, and the parent becomes the good cop and the doctor becomes the bad cop. So that creates a very deep bridge which cannot be like crossed between the doctor and the kid who has come to our clinic. So the parents should never say such things to kids. They should always say that the doctor is there to help you. Like if you tell a kid that your teacher is not good and he or she will only threaten you or beat you up, then the kid will be very fearful going to school. Like you are from this school, you have a very good aura around here, everybody is accommodative. Sometimes even if some problem happen, your teachers are always there for you. So it creates an environment. When I have seen kids from my own society, those kids who would just start crying at the very moment when they are told that they need to go to school. But now after they have been admitted to Mount Litera, they come here and enjoy. Yes. They think like यार यहाँ तो खेलने जाते हैं हम तो अभी क्या छोटे बच्चे हैं. So they feel like कि हमें वहाँ अच्छा environment मिला. So the same thing about the medical profession also. The parents should always say to kids that the doctor is there to help you, not harm you. That is one thing. And about the adults, I would say कि first go to a dentist. Try your treatment once for yourself with a clear head. If you have an issue, of course, it's not like कि जबरदस्ती आप जाइए, but go to a dentist when you need. Get your treatment done and see for it yourself, whether it is painful or not. Just having this idea in your head that you are going to have pain, you are going to have, you definitely will get well. It's all in your mind. It's all about your mind.
Actually, as a kid, I was flabbergasted by hearing that I have to go to the dentist. But I think now I'm very calm about it.
Yeah, sure. It's not like that.
Okay. So now we have a very fun rapid fire question.
Okay.
So yeah, let's get it. How often should you floss?
At least 3 times or 4 times a week.
Is mouthwash necessary?
No, not necessarily. If you are having good hygienic practices, then you just washing your mouth with lukewarm water and salt is more than enough.
Oh. What are the signs of gum diseases?
When you see swelling in your gums, the gums are getting red and inflamed. While brushing, you see small peck of blood drops coming in your brush or when you are spitting it out. Then that's the first sign and should be taken very seriously that there is some gum occurrence already, gum disease occurrence happening. So you should immediately visit a dentist.
Oh, I shall. What's the most sugar-coated thing you've ever said to a patient? Sugar-coated.
Okay, I would say that every time you come to my clinic, I will make sure that you get a ice cream when you go down.
Not every time.
When you come to me, I will make sure that your parents definitely allow you an ice cream.
Okay. I would like to come to your clinic.
Sure.
What's the best dental joke you've heard?
Dental joke?
Yes.
Okay. I have heard things like कि आप डेंटिस्ट के पास में दांत लगवाने जाते हैं और 2 दांत वहाँ और छोड़कर वापस आते हैं.
That is
like
funny.
You go to a dentist. The dentist explores the whole universe of your teeth and makes you believe that you are having more problems with your teeth than you actually believe. So it's like that.
That's right. Now we have some common myths and misconceptions about dental care.
Okay.
So there's this idea that you should brush your teeth harder to get them cleaner. Is that true?
No, this is absolutely wrong information. The harder you brush, there are more chances your teeth will get abraded. It is called adhesion and abrasion. The harder you brush, the more of the enamel of the tooth surface gets roughened off, and then it gets weared off. And then in future, later on in life, it starts that the sensitivity thing starts happening. So it is a very bad way. You should brush your teeth properly, but not hard brush you should use.
Okay. Sugar drinks are the only things that cause cavities. Is that a fact or a myth?
No. If you say that they are the only reason why we get caries, no, it's not right like that.
One of the reasons.
Yeah, it's one of the reasons, definitely, for sure. But that's not the only reason. There are a lot of things that we are eating and drinking right now. Those are the reasons why we are getting more cavities nowadays. There are people who are coming to clinic in the age of 70, 80, having all the teeth proper and none of them is mobile or carious. And other than that, there are some other kids who are coming at the age of 5 and having 4 or 5 cavities. So it's more about what we are eating right now. A very processed food that we are eating. Maida-based food and Maggi and pizza, burger. So these are equally responsible, if not the most.
Yes. That's correct. Okay, so now sadly we have the last question.
Okay.
What's a piece of advice you wish everyone followed when it comes to taking care of their teeth?
Okay. So I would like to advise people that if you have any kind of issues with your teeth or gums or you are having halitosis means bad breath, you should visit your dentist as early as possible. I cannot stress upon the fact that the earlier you go to a dentist, the easier it is to get that particular problem solved. And financially also, it's not just about the patient will be in a lot of comfortable zone where the cavities are filled and everything. So financially also, the more delay you cause to reach the dentist, it is more costlier to get the particular treatment done. So you should take your problems right from the very start point that you are having full lodgement in your teeth, you are having bleeding gums, immediately go and visit a dentist. It would be far more easier to get it done right today rather than waiting for 2 3 months when you actually start having the pain and then going to the dentist. Then actually the discomfort starts, and then people go to dentist, they get treatment done, and then they are again in pain. So go to dentist as early as possible, and as I said, 2 times brushing and scraping of your tongue, that is enough for optimum hygiene if you are careful enough. So that is something I would like people to be very focused on.
I hope everyone follows that.
Yeah.
So thank you sir for coming,
Oh yeah, sure.
spending your crucial time with us. Every single minute of your life is very, very crucial. I know that. Being a doctor. Thank you.
I'm fortunate enough to be invited to on your show, and I wish you all a very happy and a prosperous career. When you have already told me that you want to be a doctor, so that's my wishes for you, and I hope you do the best that you can.
Thank you so much, sir. Thank you. And thank you guys for watching. We'll see you guys in the next one. Till then, take care of those teeth. Bye.